Distinguished guests, welcome to Hong Kong, and very glad to be here with all of you today. And so, Hong Kong's turn. Local status of breast cancer screening in Hong Kong. Where are we? How are we doing? And compared with Taiwan, Singapore, let's start. In the coming 20 minutes or so, let's start with some breast cancer facts and how we are doing in Hong Kong. We are having some pilot programs and more for the future. Okay, so some breast cancer facts. Breast cancer is a global problem. So breast cancer concerns every country in the world. And breast cancer was the most common cancer in women in 2022. It tops the most common cancer in women in 157 countries out of 185. And breast cancer caused an estimated 670,000 deaths globally, mostly because of its increase in incidence. And roughly half of all breast cancers occur in women with no specific risk factors other than age and the gender. Okay, this is a very commonly seen, well-known graphs showing the incidence of breast cancer all over the world. This is in 2022 from WHO. It tops in incidence as well as mortality. So in Hong Kong, we have statistics by our Hong Kong Cancer Registry. A very similar graphs. Among the top 10 cancers in Hong Kong women, breast cancer is the very first, and it surpassed the second place lung cancer by almost double the number. And even we combine two genders together, okay, breast cancer is still seconded to lung cancer. However, breast cancer, this number is contributed by only one gender, whereas lung cancer is both male and females. So in the past 30 years or so, breast cancer incidence keeps climbing up. This graph is very, very similar to that of Singapore, just shown by Professor Tang. 30 years ago, about 2,000 per year. Nowadays, we are approaching 6,000 cases per year. And this is the latest data shown by the Hong Kong Cancer Registry, just published this summer, evaluating the numbers in 2023. So considering female breast cancer in 2023, breast cancer number, only invasive ones, 5,500. And with an addition of 800 of DCIS, it gives us a number of over 6,000 new cases per year. And of course, it's ranked number 1 in female breast cancer, and in terms of mortality, is number 3. With the proportion of cancers, it contributes about almost 30% of all female cancers, with the median age of onset of 60. And considering lifetime risk, 1 in 13 women would have breast cancer in their life. This graph is exactly the same as Singapore's, just shown by Professor Tang. The risk of breast cancer shoots up starting at the age of 40. So in fact, in Hong Kong, more than 94% of breast cancers are diagnosed at age 40 or above. Regarding the stage, we have, in 2023, we have stage 1 and stage 2 early breast cancers constituting about 70% of the cases in Hong Kong. So we are now on progress in Hong Kong. How are we doing? The Hong Kong Breast Cancer Registry, an initiative of Breast Cancer Foundation, is a dedicated registry built by the foundation to help bring changes in public policies and medical practice for improving breast health care in Hong Kong. It publishes annual reports and biannual bulletins. And the report in 2024 is a report number 16. It includes almost 20,000 breast cancer patients diagnosed between the year 2006 and 2018, recruited under the registry. For the age of distribution at diagnosis, most of us have a diagnosis of breast cancer at age 40 and above. So it constitutes more than 90%, very echoing with that data by the Hospital Authority, Hong Kong Cancer Registry. And the stage distribution at diagnosis, many of us were diagnosed at stage 1 or 2, constituting about more than 70% of the cases. And for the types of breast cancer by cancer stage, as you all know, with the earlier the stage, the higher possibility that we can preserve the woman's breast. So for stage 0 disease, more than 50% of the women with DCIS can preserve the breast and undergo a lumpectomy, that means breast conserving treatment. However, mastectomy still constitute a great proportion in all stages of cancer from stage 1 or above. And in fact, more than half of the women, even for stage 1 disease, have their breast removed. And indication of chemotherapy by cancer stage. Of course, only invasive cancers need to undergo chemotherapy. So that would signify that stage 0 disease, stage 0 breast cancer still make a difference, because from this chart, 1/3 of stage 1 cancer patients still need to undergo such treatment with considerable cost, duration, and toxicities. So stage 0 disease, we are aiming at that because that makes a difference. So is the use of radiotherapy after mastectomy. The charts climbs up with the advance in stages. Regarding the methods of breast cancer detection, what are the difference? Let's look at these 2 rows, okay? Self-detection by chance, that is symptomatic presentation, in contrast to mammogram screening, asymptomatic presentation. If we look at the numbers, mammogram screening can detect 40% of breast cancers detected by mammogram screening. Stage 1, another 40% another 40% even stage 0, that is DCIS. On the contrary, if we wait for the women to be breast aware enough to pick up the symptoms themselves, okay, most of them, about 60% of them still have a stage 1 to stage 2 disease. So sadly, regrettably, 80% of our women have their breast cancer diagnosed by symptomatic presentation, and about just 1 in 10 of them got them screened and then detect the first breast cancer. And I remember Professor Tang just mentioned that in Singapore, the participation rate is trying to hit 40%. And the worst group seems to be the Malay group, 21.5%. Okay, look at us. Okay, for those who ought to be screened, that is age 40 or above, okay, less than 1/5 of them are actually screened. So we are doing even worse than the worst group in Singapore. And back to the survival. And Hong Kong Cancer Registry, we have considering the overall overall stage as a whole. In the 2010s, that is 2010 to 2017, the survival in general for Hong Kong breast cancer women, we're not doing bad at all. More than 85% 5-year survival. And for the youngest age group, we are even reaching almost 90%. However, are we satisfied with that? Can we further improve our survival? Okay, this graph is no stranger to any one of us sitting here, be it primary care providers, surgeons, oncologists, professors, everyone, okay? Breast cancer survival decreases with the advancement in stage, okay? Can we further improve the survival of Hong Kong women? by decreasing the number of advanced disease. So how are we doing? We are progressing with pilot programs. The CHP of Hong Kong, Center for Health Protection under Department of Health, has a cancer expert working group on formulating guidelines based on scientific evidence to recommend the prevention and screening for various types of cancers. Back in 2004, like 20 years ago, when Singapore first started the national screening in 2002, where were we? We were, in fact, if you look at here, routine mammogram screening for general female population was in fact not recommended, while Singapore was already doing the national screening. Okay, 10 years later, where were we? Okay, not too bad, improving, because if you look at number 2, so sorry for the small prints, there is insufficient. Okay, let's look at point number 1. There's insufficient evidence to recommend for or against population-based mammogram screening. So from not recommended to being neutral in 10 years. And where are we now? Okay, point number 3. In fact, the Cancer Expert Working Group is now recommending risk-based approach for breast cancer screening. So we are moving forward, definitely. And in 2021, we started, the Department of Health launched the breast cancer screening pilot programs, phase 1. In the 2 years of screening pilot program duration, a total of 27,000 women was assessed based on the risk of breast cancer. And out of them, we screen our patients with certain combination of personalized risk factors. Those women assessed would be between the age of 45 to 69. And then out of them, 7,700 underwent mammogram screening. And at the end, in 2 years, 68 cancers were picked up, and making a detection rate of 8.7 out of 1,000 screening mammogram, which is comparable to the international standard. And out of this 68 confirmed cancer, 66 of them, that is 97% of them, are stage 2 or below. So we are achieving quite well with screening. And this year, we have the launch of the second phase, breast cancer screening pilot program. So it's a 3-year duration program. We have Dr. Polly Jang, we have Dr. An Chi. And the eligibility of participants include women of 35 to 74 years of age. We aim at high-risk breast cancer individuals. They must be a Hong Kong ID holder or citizens. And what is high risk? High risk means carrier of certain genetic mutations or with a very strong family history of breast or ovarian cancer. The criteria is quite stringent. If you look at the details, we include first-degree family relatives, confirmed carrier of mutations, or at least 1 or 2 family members with both cancer, ovarian cancer, etc., etc. As you can imagine, with these criteria, many of the women who are at risk of breast cancer just because of the gender and age are not included. Okay, for the workflow, those women eligible would have would have the result being conveyed to them by the service provider. Normal results, we have another screening 1 year afterwards. And those with abnormal results, if indicated, additional screening, additional mammographic imaging or ultrasound, and plus or minus referral to specialist care. So more for the future. Are we satisfied with what we are doing now? If we look at the details, the breast cancer screening tool of this phase 2 program, 2D mammogram is adopted, 2D mammogram. And for Asian breasts, we have the problem of the breast density. So 2D mammogram may not be as sensitive as a perfect screening tool as in other Caucasian countries. And we have several NGO clinics, service providers, and the clinics are service scattered all over the territory, mainly over Kowloon. And of course, Hong Kong Breast Cancer Foundation is one of the service providers through the breast health centers. This is in fact the only NGO clinic having the in-house image center. The rest of the NGO clinics service providers, they will have the women being called in for inquiry, and then they have outsourced imaging centers away from where the clinics are situated. So can we do further? Education, knowledge is a problem. We are at this stage keep educating women about the importance of early detection, the importance of having breast awareness, and are we doing enough on the importance of breast screening? Breast cancer screening, do they know that who need to be screened and how it should be screened and how often the screening need to be? Do they know how to read the reports? Many of them raise the question, is mammogram a must? Do they know the importance of mammogram or the shortcomings of mammogram as a diagnostic tool? Do they know the importance of early detection? They save them all the hassles of prolonged systemic therapy. They can have much higher chance of preserving the breast by breast conserving treatment. They have much more surgical options, even though they have to have the breast removed with mastectomy. So what we are doing now, the Cancer Expert Working Group, the government has in fact launched population screening programs for colorectal cancers, for cervical cancers. Even though for those with average risks, just because of their age, colorectal cancer and cervical cancer, breast cancer has the highest incidence among women breast cancer in Hong Kong, and surpassing both of these cancers. And we are focusing at this time we are still focusing on the high-risk groups, whereas for the population screening, we still have something to work towards to. So breast awareness is important. However, awareness is not protection. It's not protection. Action is. And we are trying very hard to get every woman to work towards a population-based screening in the territory. And I'm sure there's much to learn from Singapore and Taiwan. Thank you very much for your time.